there was that one study in the presentation where lavender could be as effective as Ativan, and we know that Ativan can be really addictive or habit forming. So, I mean, if you had the choice between the two and they potentially work equally, why not try the lavender? Afre Guam and beyond, this is Dr. Luan Nguyen, the longevity doc. So I am here with Ajay Lad. He is a naturopathic doctor in Canada, around the Toronto area.
Yes.
So, you know, a lot of people actually in Guam don't really know what is a naturopath, a doctor, and you know, it's been around for a while. But you know, my hope is to maybe credential and bring in and recruit some naturopathic doctors, and because I think they play a vital role in, I think, especially nowadays, medicine has changed, or the conditions have changed. Chronic disease is really rampant, and I think our approach has to change on how we treat chronic disease and the new phenomenons and things that we're seeing right now, which was never a big factor even 50 years ago. So I want to ask, you know, for the audience, you know, what is a naturopathic doctor? How do you, you know, what is the education or schooling, and how do you get to this path?
Yeah, for sure. So a naturopathic doctor is kind of an integrated health provider. We go through 4 years of undergrad. So my background's from Queen's University, is more immunology pharmacology. Then we do 4 years naturopathic medical college, so it's like 8 years of training. But we have an approach where we have a big toolbox to work with. So we are trained in acupuncture, homeopathy, nutrition, herbal medicine, and we try to integrate that to see what's a more personalized type of delivery method for the medicine. Because if you have two patients who have headaches, you wouldn't say, I gave this person a pill, same one for you. One person could have a headache due to, say, a stress response or food sensitivity or whatever it is. So we try to go through the whole health history to see what's going on, right?
Yeah, so there's a lot of detective work, and it's certainly more personalized medicine. Yeah,
for sure.
And is there a kind of a philosophy in terms of naturopathic, and it's not necessarily just functional, but I guess what would say your philosophy would be in terms of treating or diagnosing, or you know, encountering patient encounters?
For sure. I think the biggest philosophy is try to find the root cause.
Yeah.
So why does someone have whatever's going on, right? A typical naturopathic visit will last, initials an hour and a half. Some people even do 2 hours, and then subsequent visits are an hour. So we try to basically go through the entire health history to find out if someone had, say, for example, a headache. How long have you had the headache for? Was there any, you know, emotional issues? Was there like psychosocial stress? All that stuff, not just treat the headache itself. So yeah, the root cause is a big thing as well. We tend to look into like genetics as well too, in terms of epigenetics. That's one big thing as well. But yeah, root cause.
Okay. Yeah. So we've been talking for about. We actually graduated just yesterday at our integrative med fellowship. So this is our connection here, and we're out in the AIHM conference, but we've been talking, and I know Ajay has a niche, especially in gastroenterology type conditions, but also more in the mental health side, anxiety and stress, and even depression. So, you know, typically if you go through the primary care clinic, such as mine, or family practice, the typical approach for someone that may be exhibiting stress or depressive type symptoms, you know, we might have them fill out a PHQ-9 or GAD-7 questionnaire to see if they have some of the symptoms that would kind of most likely lead them into a diagnosis of depression. And then from there, we might refer to CBT or cognitive behavioral therapy, plus add on maybe SSRIs, you know, things like Paxil or serotonin receptor inhibitors, right, or reuptake inhibitors. So, but as a naturopathic doctor, what would your approach be if, you know, people are exhibiting depression, or, you know, fall on that score on a PHQ-9 that's pretty high?
Yeah, for sure. Like we do use similar like assessment tools like PHQ-9, GAD-7, and what we do is kind of see, okay, how long they've had the issue for. Is it a trauma response? Is family history? Is it dietary, nutritional deficiency? And try to treat it in that sense. So, so we look at diet as well too. Are they getting enough cofactors or nutrients to make like basically the neurotransmitters, right?
Because a lot of the neurotransmitters need B12 and a lot of B vitamins, even SAMe. So there's a lot of cofactors needed to make serotonin and
Exactly.
et cetera, right?
And even protein, like you need enough amino acids to make basically tryptophan or whatever it is, right?
Yeah.
So we look at that to see, is dietary wise, do you have enough, right? Then we also use, or I tend to use a lot of like herbs as well, like, kind of like St. John's wort, or even like say valerian as well too.
Yeah.
But homeopathy seems to work well in my practice, and acupuncture. So acupuncture and homeopathy are more like kind of a holistic energy medicines as well too, that kind of deal with the mental, emotional plus physical.
Yeah.
And I find that tends to work well too, right? The one thing too is that natural remedies, they're, even though it's natural, doesn't mean it's safe with basically prescription meds as well too. So you need to have a qualified health practitioner to basically evaluate that for you too, to make sure there's no interactions.
Yeah.
Especially with St. John's wort, like I mentioned, if you have SSRI, you need to be careful with that too. So, because arsenic is natural, you wouldn't be taking that, right?
Yeah.
So, but a lot of talk therapy as well too. That seems to work well. But yeah, acupuncture, homeopathy, herbs, and the basic dietary response. Even sleep. Make sure sleep hygiene is going well too, right?
Yeah.
So
can you go over maybe a case, like especially a difficult case that came to you, and explain the process of what you found and how you treated, kind of putting it all together?
Yeah, I guess one that comes to mind, there was a 54-year-old female, and she basically, good job, family life, the whole gamut, and she came in with severe anxiety. Basically, couldn't sleep, mind was super active, it was just basically all over the place. She tried medication, it wouldn't work, and she just couldn't shut off her mind. And this was for the last, we asked her, so how long have you had this for? And she was like, last 5 years, let's say. And in talking about that too, basically like what happened 5 years ago?
Yeah.
Well, she was having marital problems, and her husband left. Same time, her father passed away. Like, there were a lot of big, major events.
Right.
And she had 2 kids, teenagers, but still, she was taking care of them. That a lot of things were going on, and her job was obviously stressful. So, with her too, her anxiety kind of was a result of her not being able to basically handle everything, because she had a lot going on.
Yeah.
And ideally, when you have, like, say, a stressor, ideally you kind of rest equivalent to that stressor, and that's the perfect world. But for most of us, we're juggling so much stuff, right?
Yeah.
So with her too, we said, okay, here's some stuff for your anxiety, but also deal with adrenal support, nervous system support to help boost her up, and also social counseling as well. So basically help out in terms of, here's some social supports for what's going on, and it seemed to help out. What I used in her case too was more like acupuncture to help her get grounded as well too.
Yeah.
And used herbs like, say, passion flower and skullcap as well. Yeah. And also look at her diet, because when she was juggling around with everything, she wasn't really eating either. She was kind of grabbing, going, have the fast food here, fast food there. So her caloric
poor
intake.
nutrition.
Yeah.
And probably not getting enough cofactors.
Exactly.
And did you use any particular supplements for adrenal support? Did you use like adrenal complex, or what did you use?
Yeah, a lot of adrenal complexes have the B vitamins. They have like Siberian ginseng. They have ashwagandha.
Yeah.
And so I used like mainly like those herbs were very safe with her as well, right?
Yeah.
So.
Yeah, and then something we learned in the fellowship, but also reinforced in this conference, was lavender.
Oh, yeah.
So I might be using that a little bit more, because there was that one study in the presentation where lavender could be as effective as Ativan, and we know that Ativan can be really addictive or habit forming. So, I mean, if you had the choice between the two and they potentially work equally, why not try the lavender?
Yeah, definitely. Like lavender, like what happens is when you're in that rote response, that fight or flight, lavender, just even sniffing it, helps to break that as well too. Yeah. So your body settles down, and basically you kind of like reset pretty much, right?
Yeah.
So it works really well.
Yeah.
So.
All right. Yeah. So there's, I think, a lot of stuff we can tap into and really change the scope of mental health, wellness, and treatments. And I think incorporating functional medicine or even naturopathic medicine could be a very, very good integration to help this field, since there is a big rise of mental health illnesses, right? Depression, anxiety, suicide's a big problem, especially in Guam.
Yeah.
So hopefully keep doing your work.
Thanks, man.
Yeah, and hopefully, I might have to do some telemedicine consults with you.
Hey, anytime, man.
Help me out here.
No, for sure.
Is there anything else you want to push out about naturopathic medicine, or where we can find you, or if you push out any content or anything?
Yeah, I guess my website, drdetox.ca. If you have any questions, you let me know. Any collaborations with this guy, we'll be there as well too. But yeah, that's probably the best way over there. And yeah, naturopathic medicine, like I said, it's more holistic, and in terms of integrative medicine, it kind of goes right with that, part and parcel as well. So yeah, that's good.
Well, thanks a lot.
Hey, no worries, man.